And with that, I give the call to the most honourable member for Werriwa.
Thank you very much, Deputy Speaker. It's easy to take the Medicare card for granted. All Australians above 15 years of age can obtain a card of their own. And despite the system not being perfect, it really is the passport to the world's best universal health care system. Medicare is uniquely Australian, and it is something that as a nation we can be very proud of. The antecedent of Medicare is Medibank and was the promise of a previous member for Werriwa in 1972, and our community still values health above anything else. Prior to Medibank and Medicare, I remember the conversations around the table about whether my parents could afford to take both or one of us to the doctor, and the home remedies that were tried and often failed before a doctor's visit was planned. My parents and our country were excited for Medibank. There would be no more bankruptcy to stay healthy. The disdain for the universal healthcare system from those opposite was established from the outset, as far back as 1975. When Malcolm Fraser took office, Medibank was changed any number of times, to the point that it eventually in 1981 ceased to exist at all, except in the guise of Medibank Private. Thankfully, the return of Labor under Bob Hawke saw the reinstatement of Medibank, this time in the form of Medicare in 1984. And, as they say, the rest is history. 42 years after Bob Hawke reinstated it, Medicare continues to be the envy of the rest of the world. Interestingly, despite constant attacks by those opposite, Medicare has never been stronger or more supported by the Australian public. Indeed, Medicare and the PBS are among the most trusted federal public services in the country. Central to Labor's philosophy and DNA is Medicare. We will always defend it and strengthen it. To that end, the matter before us today is yet another step in the Medicare story. The bill establishes a clear legislative framework for the Commonwealth Primary Care Incentive Payments Program, including the Medicare Bulk Billing Practice Incentive Program. It does this while leaving operational detail to the incentive payment program rules. At present, Deputy Speaker, these programs lack a clear legislative basis which impacts their effective administration, including robust processes to enforce compliance and protect program integrity. By introducing these amendments, the government will strengthen the way it provides financial incentives to primary care providers and ensure the integrity of existing and future incentive programs. At its heart, this bill supports the Albanese Labor government's $8.5 billion commitment to expand bulk billing for all Australians, which includes the incentive programs for practices that bulk bill every patient. The success of this initiative has been nothing short of phenomenal. The latest quarterly bulk billing data shows the national bulk billing rate at 81.9% for the January to March quarter. This is a 4.6 percentage point increase for the same period last year. Further, as a result of this initiative, there are now over 3,800 bulk billing practices around the country. Previously, more than 1,400 of these were mixed billing practices. The upshot of this means that approximately 97% of the population are now within a 20-minute drive of a bulk billing practice. Across New South Wales, the bulk billing rates stand at 85.4%, up 4 percentage points. But in Werriwa, the numbers are even better. There are 32 bulk billing practices in Werriwa, which is an increase of 7. This means that well over 90% of all GP consultations in Werriwa are bulk billed. Personally, I find it extremely gratifying to travel through the electorate and see the distinctive green and gold Medicare bulk billing signs which identify a fully bulk billing practice. Complementing this huge lift in bulk billing are the additional number of Medicare urgent care clinics across the country. Since the urgent care clinic network commenced in 2023, there have been over 623,000 bulk bill visits in New South Wales. In Werriwa, the newly opened urgent care clinic in Austral has seen thousands of patients, both helping those who need to see a GP as well as taking the pressure of our stretched public hospitals. I received feedback over the last weekend about how well the Austral Urgent Care Clinic is working. Chris is a constituent who has used the Austral Clinic and wrote to me with the following feedback. I used the Austral Urgent Care Clinic around 6 weeks ago as I had a severe cut to my finger, not enough for hospital, but more than I could take care of myself. My local GP was booked out and may not have been able to treat it even if they weren't. The Austral Clinic was excellent in treating me. Short wait time, great staff and a successfully stitched finger. Follow-up care was provided by my GP clinic. I'm writing to give feedback that these urgent care clinics are a great initiative and, at least for me anecdotally, provide a great service to the community. I'm happy that Labor put forward these clinics and will support them going forward. And that's a solid win for this policy and our government in my eyes. The upshot of the Medicare Incentive Program is that our universal healthcare system has never been stronger or more popular. Time today does not permit me to speak on the other parts of our health system, particularly the pharmaceutical benefits scheme and this government's support for our public hospitals across the country. But suffice to say that along with the pillar of bulk billing, the picture looks wonderful. Australians look to their government, and especially this parliament, to support them with the services and programs they need most. Of these, perhaps none is more dear to Australia's heart than Medicare and bulk billing. The bill supports the provision of this most important program. It should be noted, Deputy Speaker, that Medicare Incentive Program also supports our primary healthcare professionals, most notably GPs. After years of neglect, the incentive program ensures that our GPs are appropriately remunerated for their skill and dedication. And I'd like to give a shout-out to all the GPs in my electorate who've embraced the incentive program and in doing so are now supporting bulk billing. To stand here as a member for Werriwa to speak about this bill and Medicare is a privilege. The cost of living pressures in the electorate are real, but the Medicare Incentive Program makes a real difference to thousands in my electorate, and it means they don't have to think twice about seeing their GP if they're unwell. I commend the bill to the House and thank the Minister for bringing it forward.